you very much.
So it appears we have a cup of coffee.
Imagine an Ebola outbreak reaching Kenya today. Will our borders stop it? Will our hospitals be ready? Will the country respond faster than it did during the previous health emergencies? These are some of the questions many Kenyans continue to ask as neighboring countries strengthen measures against the deadly virus. Today, Health Principal Secretary Mary Muthoni addressed those concerns.
And we are also ensuring that anybody coming into the country passes through the right processes so that we can safeguard and protect our borders and also protect our people. Indeed, there is need for proper preparation for future outbreaks, including having the right equipment for lab. At least our lab capacities have really improved from the time of COVID. Right now we can do tests for all those diseases, as opposed to before when COVID we could send our samples as far as South Africa, as far as UK, India. Today we are able to test because our lab capacity is good, and we are continuing to construct and equip our labs capably.
According to the Principal Secretary, no country can fight an outbreak alone.
And it's very important for our region to have that, because we will also have real-time cross-border surveillance and data sharing whenever we have issues. Like now we've been doing surveillance around Ebola, and we've been having meetings with Tanzania, with Uganda, just to make sure, because pathogens have no boundaries and diseases too have no boundaries. So we have to keep doing surveillance between or amongst the countries to ensure that everything is well. Equally, it is a point in time that we standardized our ports of entry. You see, we could be doing the right thing, but if our neighbor is not doing the right thing, then we are still at risk, and very high risk of having diseases, emerging and re-emerging issues in our society. The other thing is also issues to do with resource mobilization, which is very, very critical. If one of the countries there's an outbreak and you can access medication possibly because you can buy the medication, and in the other country we are having a challenge, then that is something that we really want to standardize in regards to resource mobilization, pulling together even in terms of procurement, because it is easier, it is faster, and it is also consolidated in a better manner.
One of the biggest concerns for many Kenyans, however, remains simple. As Ebola reached Kenya, the Health Principal Secretary responded directly.
And I want to confirm to the country that we still do not have any Ebola case in our country. And we are very keen to ensure that surveillance goes on along the borders. We are very keen to continue training our healthcare workers. We are also happy with the institutions that have led the process like Port Health to ensure that our borders are well manned. At JKIA, we are still having our flights coming through Gate 16. And in fact, we have rolled out a self-screening app to ensure there's no mulling up of travelers at the border, called Uhai.
The Ministry of Health says preparedness does not end at border screening. Laboratories, healthcare workers, and emergency response systems must all be ready before any outbreak occurs. The briefing also touched on one issue that has generated public debate in recent years: the proposed Ebola quarantine facility in Laikipia.
I know this is very interesting. You wanted to ask about the Laikipia? Yes. There is a difference between being isolated and quarantined. When you're quarantined, it doesn't mean you're sick. We are separating you from others because you've been exposed. Probably you've been a nurse, a doctor, or a healthcare worker who's been exposed to people who probably also had the disease. So you may not be on medication, but we are just keeping you aside so that you don't get to mingle with other people. But when you are isolated, we are actually treating you. So when we talk about isolation centers and quarantine centers, how we would wish that we even have each in every county, so that should there be any outbreak in our country, then we are safe. And every of the county would be able to take care of a certain population. On issue of Laikipia, really, we are people who follow the law. So when the court said that we stop, we stopped. And I do not have any further information of anything after that.
Although Kenya has not recorded any confirmed Ebola cases, health authorities say the country remain on high alert as surveillance continues across the region.
Uganda recently declared themselves Ebola-free, having had 21 days of no new Ebola cases, having cleared all their cases, and that is important. In terms of is there a chance, really the reason why Uganda was able to manage this outbreak, first of all, the numbers were low, yes, but they had quick responses. You know, they had people sent to the communities as soon as it was declared. They had teams deployed as soon as it was declared. So that is one of the success factors. But when it comes to cross-border surveillance, you can't really say that they are safe from it happening. And that's why there's been an MOU between the Democratic Republic of Congo and the Republic of Uganda on cross-border surveillance and supporting the outbreak in DRC. So yes, like the PS said, diseases don't know boundaries. They don't need visas. So there is a risk. But I think they're on the lookout. They're doing surveillance. They're monitoring everyone crossing their borders. And so their risk is just as any other person's risk, you know. But yes, but they've declared themselves Ebola-free.
IGAD has been at the forefront of supporting the IGAD member states. So apparently, as you know, we have a number of, Uganda is one of the IGAD member states, as well as Kenya, Ethiopia, and many other countries in the Horn of Africa and part of the East African countries. So IGAD has managed to mobilize resources to support the countries. Recently, in May, towards the end of May, IGAD, convened ministerial meeting to strengthen member states' capacity and supporting member states, through resource mobilization to, in terms of supporting the countries on preparedness and response to Ebola outbreak. So there's that level of effort that has been ongoing. Some resources have been currently under discussion to be disbursed to the countries through the pandemic fund within the IGAD portfolio.
The government says stronger laboratories, trained healthcare workers and closer cooperation with neighbouring countries will be key to preventing future outbreaks. For Benchumba Digital, I'm Benchumba.
Thank you very much.
So it appears we have a cup of coffee.